Good afternoon, everyone. Thank you for joining us. I want to thank Chief Matt Slinkard here to invite us and be a great host at Houston PD here and all the great men and women in uniform that he's leading, and as well as the interagency partners. I also want to especially thank Mike Daniels. The great work that is being done by Houston HIDA is exemplary. Today I'm here and I'm really pleased to announce the $275 million in funding for the 33 regional high-intensity drug trafficking area programs across the United States, including nearly $12 million for Houston high-intensity drug trafficking area program. Now, what are they doing? Well, let me tell you, they are actually working to disrupt and dismantle the drug trafficking and money laundering organizations and reduce the supply of illicit drug in cities like right here in Houston and communities all across the nation. This funding of $275 million will provide additional resources that are critical to the ongoing work of the men and women on the front lines of stopping the overdose epidemic, some from whom I heard about today. These new funds will support their work and will build upon the Biden administration's national drug control strategy that I announced last week. Now, let me tell you why. We are right now facing a crisis of overdose deaths. Latest numbers tell us that we have almost 107,000 deaths from drug overdose that have occurred up until the 12-month period until November 2021. What does that mean? That means that there's an American perishing to drug overdose every 5 minutes around the clock. Now, this is an urgent priority for President Biden. This is about going after the bad guys and making sure that we are saving lives. So our strategy really focuses on the two big drivers of the epidemic: untreated addiction and the drug trafficking. And it unveils a renewed focus on disrupting transnational criminal organizations and their illicit financial networks and supply chains. We have already brought the international community together recently to control fentanyl precursor chemicals. And President Biden's budget proposal includes substantial increased investments for border security and supply reduction, including about $300 million more for Customs and Border Protection and about $300 million more for the Drug Enforcement Administration. Now, today's funding for HIDAs across the nation will support those ongoing efforts to prevent overdoses and address drug trafficking and related violent crime by, first of all, supporting the illicit drug-related investigations and interdictions efforts nationwide. And secondly, sustaining our investment in HIDA overdose response strategy, which is a unique collaboration with the Centers for Disease Control and Prevention to improve real-time response to overdoses across the nation. In addition, this funding supports new initiatives to reduce the violence associated with drug trafficking, refine interdiction efforts through enhanced data sharing and targeting, as well as dismantle the illicit finance using innovative approaches, including cryptocurrency investigations. And we'll get this done by leveraging the strategic partnerships with federal agencies, academic institutions, nonprofit organizations, the private industry, and state and local law enforcement and investigative agencies. The bottom line is this: we have to hit the drug traffickers where it hurts them the most, and it's their wallets. We got to go through looking at the entire process of illicit financing, including illicit drug trade, trafficking, production, supply chain, financing, enabling of drug trafficking, all of it. Through the President's strategy, we will work to more than triple the number of drug traffickers sanctioned and increase our border security. We'll continue our important work with other nations as well to make it more costly for drug trafficking organizations in every way possible. This work is critical because, let me be very clear, today in America, if it is easier to get illicit drugs than to get treatment, we're never going to be able to bend the curve on overdoses. And that is exactly why, while we work with going after the drug traffickers, we must make sure that we are quickly getting people the help that they need. Why is that? Because the reality is, today, only 1 out of 10 people who have a substance use disorders have access to treatment. And that's just unacceptable. The President's strategy will expand evidence-based public health interventions that prevent overdose deaths, like naloxone, an opioid reversal antidote, and increase access to treatment and recovery support services. The strategy also directs federal agencies to work with state, local, and tribal communities to expand efforts to prevent substance use among school-age children and young adults. Because we know that if we invest in prevention when people are young, they are much less likely to develop a substance use disorder later in life. And the strategy also includes specific actions to improve access to medications for opioid use disorder programs in jails, in prisons, and identifying ways to advance racial equity in investigations, in arrests, and sentencing for drug-related offenses while strengthening public safety. Now, our new strategy is a whole-of-government approach, and from President Biden on down, we're all committed to this mission. We're committed to working with leaders from red states and blue states because, you know what, the overdose epidemic does not care about an individual's politics. We know all that. We know that. Now, it's going to take all of us working together to address this new challenge that we face today. And I know that together, through new funding for HIDA programs and the President's comprehensive strategy, we can beat this. And we can save lives. So thank you very much.